Hello. Thanks for tuning in to this overview of the 2024 Research Update Breakfast, presented by the KU Alzheimer's Disease Research Center. I'm Rachel Sandoval, a registered dietitian and the manager of our LEAP program. I'll be walking you through the biggest highlights and takeaways from the event. We'll talk about exciting new advancements in brain health and Alzheimer's research, including better ways to detect the disease early, promising new treatments, and practical ways to support brain health. After a warm welcome from our host, Community Engagement Coordinator Kelly D. Loeb, our co-director, Dr. Jeffrey Burns, explored an exciting shift in how we approach Alzheimer's. Instead of just focusing on managing the disease, more and more research is showing that prevention is key. By catching early changes and making lifestyle adjustments, we may be able to slow or even stop Alzheimer's before it progresses. This is a really exciting time for brain health science, and we are very excited to be a part of it. ADRC co-director Dr. Russell Swerdlow shared updates on how we diagnose dementia, moving beyond traditional cognitive tests and MRI scans to include new blood biomarkers and molecular imaging that can detect changes much earlier and with greater accuracy than what we've had before. Dr. Eric Vidoni shared some fascinating findings on how exercise impacts brain function. Several ongoing studies are looking at different types of exercise to see what's most effective. The IGNITE trial is studying how the length of endurance exercise affects brain health. According to preliminary results, exercise may support some aspects of brain function, but this depends on how well you stick to your exercise plan. The related RAD study is exploring how exercise and blood pressure control affect cognition. In this study, both a blood pressure drug and exercise, respectively, were effective at lowering blood pressure or cholesterol, though the drug was slightly more effective. The COMET study will compare endurance training with resistance exercise to see which has a bigger impact on brain health. Dr. Jill Morris's research suggests that exercise affects how the brain uses fuel, which means that personalized exercise plans may be the way forward. For those with exercise limitations, her team's FIGHT AD study will examine whether hot tub exposure could mimic the positive effects of exercise on the brain. Dr. Brian Helsel also provided a number of exciting research updates regarding exercise and brain health in individuals with Down syndrome. Across several studies, Dr. Helsel and his team are working on improving physical activity measurement and promotion in adults with Down syndrome to help support long-term brain health. For example, the Brain Power Exercise and Coaching Study, which had a 100% retention rate, significantly increased participants' physical activity levels. On the treatment side, monoclonal antibody therapies have reached their fourth year of clinical trials, showing promise in targeting amyloid and tau proteins that are linked to Alzheimer's disease. These treatments are helping researchers move forward towards more personalized and effective approaches to treatment. Getting a timely diagnosis and care can be challenging right now due to long wait times and limited access to specialists. And to help with this, our researchers are working on better screening tools for primary care doctors and strategies to help make expert dementia care more widely available. There are also some fantastic programs at the KU ADRC that are turning research into action. The Brain Health Training Program, led by Dr. Eric Vidoni and Ann Arthur, is helping healthcare professionals improve dementia care. The APP Brain Health Fellowship is training advanced practice providers to diagnose and manage dementia. The Cognitive Care Network is providing education and support to over 1,300 families affected by dementia, and the LEAP program is helping thousands of people take charge of their brain health through evidence-based classes like Brain Health Bootcamp and our Mediterranean Diet course. One of the most hopeful takeaways from this event is that according to some studies, nearly half of dementia cases could be prevented or delayed by addressing risk factors. Things like heart health, diet, sleep, and exercise all play a role in protecting the brain. Research shows that even small changes can make a big difference, both at the individual and community level. Looking ahead, KU ADRC is focused on making early detection easier with new diagnostic tools, expanding access to dementia care through programs like the APP Fellowship, and even building a brand new brain health facility in partnership with the University of Kansas Health System and KU Medical Center. The 2024 Research Update Breakfast was full of hope and exciting progress. By shifting the focus to prevention and early intervention, we're moving toward a future where Alzheimer's and other dementias can be better managed or even prevented altogether. Thank you so much for joining me today. If you'd like to learn more, you can visit our website at kubrainhealth.org or contact our research team at 913-588-0555, option 1. Together, we can make meaningful steps towards better brain health for everyone. Thanks for listening.